UVU Health began vaccinating around noon, and Intermountain started just after 1 at LDS Hospital. That's where we find ABC4's Jason Nguyen. And Jason, you got a front row seat to the vaccination. How'd it go?
Hey, good afternoon, Emily. Things went very well here. It was impressive to see all the things that we have been talking about for the better part of the year. But four nurses were the first to get the COVID-19 vaccination here at the LDS Hospital. And within the last 2 minutes, I was told 90 people are going to get vaccinated right behind me today. So that's really good news. But this all started earlier this afternoon around 1 o'clock with Monty Roberts. Monty Roberts, he's an ICU nurse, and he was very emotional, telling us, quote, "It is super emotional and super frustrating fighting COVID-19. He says he worries about his family and bringing home the virus and is happy medical professionals have a very good weapon to fight the virus. He says the next 21 days will be status quo for him until he gets his second shot. I asked him what he plans to do after that second shot differently, and here's what he told me.
I don't see myself doing anything different. I'm still going to protect myself the best that I can so that I can protect the other people that are around me, so that I can provide the best patient care that I can.
Now, I talked to Roberts off to the side, and he says the biggest key is that people need to continue to wash their hands, wear a mask, and socially distance themselves. I also talked to state epidemiologist Dr. Angela Dunn, and she tells me more vaccines are on the way to the state, especially once that Moderna vaccine passes that FDA emergency use authorization process. But coming up at 5, or at 4:30, I should say, I'm going to introduce you to another doctor who says the next 10 days are the most critical for all the patients that are getting the vaccine, and I'll tell you why coming up at 4:30. Until then, I'm Jason Nguyen, live in the Avenues, ABC4 News.
Okay, Jason.